Okay, good afternoon, and thanks everybody for your time as we talk about where we are with COVID-19. Once again, my name is Dr. Alex Garza, and I'm representing the Pandemic Task Force here in the St. Louis Metropolitan region. As we've noted, we've received some questions in advance of this briefing, and we'll address those shortly. If reporters have other questions, please email those to the task force public information contacts, and we'll address them either later in the live stream or later today. Now, before we talk about the data that we have to share today, I wanted to speak to those who remain on the front lines of this crisis. To those of you who work in healthcare, first responders, grocery store workers, and everybody else, I first just want to say thank you. You're doing a tremendous and essential job. Your work is vital, and I'm sure I speak for all of the community in saying we are grateful for all of your efforts. As we all know, this situation has created enormous challenges. All of us are working together to make sure we stop the spread of the virus. If we do that well, we should be able to get back to normal as soon as we can and as soon as it's safe to do so. In the past week, I've heard repeatedly from people all across the area that want to do something to help. And I would just remind people the very best thing that you can do to help in the community, or at least one of the first things that we need to be doing, is to taking all of those appropriate precautions to stop spread. And so that's following social distancing rules, washing hands frequently, cleaning surfaces, and being mindful of others. So now let's take a look at the numbers that we have from today. And again, we don't want to draw conclusions from day to day. When we look at data, we look at trends, we don't look at fluctuations from day to day. There's just too much ambiguity over that. And so we look at things over time. As a reminder, these data are drawn from the 4 healthcare systems in the metropolitan area: SSM Health, BJC Health, Mercy, and St. Luke's. So as you can see, our hospitalizations are up slightly from 586 yesterday to 611 today. The number of patients in the ICU is down slightly. It was 239 yesterday, and today we're showing 219 patients. And the number of patients on ventilators is also down, just slightly. Yesterday we had 186 patients on ventilators, and today we have 173. We're still showing those same approximations of around 70% of patients in the ICU are ultimately going on to ventilators, and that trend has continued in St. Louis. And again, I would remind people that these aren't just numbers, these are patients, and they deserve our thoughts and prayers. Across the system hospitals, we had over 25 COVID-19 patients that were discharged yesterday alone. In terms of capacity, and I know this has been a frequent question, is how are we doing on capacity? At these numbers, we're continuing to do okay. At this point in time, our teams are working across our health systems to develop some more overarching figures so that we can give a more realistic number on how we're doing on capacity. But I do want to stress that these numbers will continue to flex and contract, and that's really based on volume. And so we have plans in place, so if we see increases in COVID-19 patients, that we can increase our capacity. But we all also understand that that capacity is not infinite. And so that it's why, again, it's essential that we decrease the spread so that we don't get close to overwhelming our capacity. Now, before I take questions, I want to talk about one other critical issue, and one that we've been discussing quite a bit here lately. And that's the disproportionate impact of this virus on people of color and socioeconomic groups. That disproportionate impact is happening around the country. We've seen it in multiple other metropolitan areas, and St. Louis is no exception. Now, there's many reasons for this disproportionate impact, and I think we've spoken about that. But there's not one single solution. It's a complex issue, but the issue can't paralyze us for what we need to be doing both today and into the future. The reasons for these disparities have to be addressed, and these are fundamental underlying societal issues. We have to address them because it's the right thing to do, not only now, but also going forward. We have to ensure that the entire community is safe and well, and that no community in the future bears the burden of any disease, not just COVID. The virus shows us clearly that we're all connected, and that if one part of our community is at risk, then we're all at risk. However, we know some parts of our community are more at risk than others. As a task force, we are already working with partners to view and address this situation through an equity lens. We are working with our federally qualified health centers, the Regional Health Commission, public health departments, and others. And we're working with them to develop and deploy responses that puts more resources into those communities where the greatest needs are. One example of that response is Prepare STL, and this is an initiative that was launched today by the Regional Health Commission, the St. Louis City and County Public Health Departments, and other organizations. This initiative includes advertising, educational materials, community canvassing, and mobile outreach. And this is to get information about the virus into the hands of those communities that are going to have the highest impact. This campaign will also get information into the hands of immigrants and new Americans. Starting this weekend, canvassers who will be wearing some personal protective equipment will be going around to high visibility community hotspots like grocery stores, convenience stores, gas stations, laundromats, pharmacies, and they'll be placing informational posters at these locations. Zip codes with high poverty rates will also be the focus of Prepare STL community canvassing. We're grateful to see this initiative and are committed to work with those involved to look at other ways on how we can address part of this issue, again through an equity lens. So thank you to everyone involved in Prepare STL, and this includes the Regional Health Commission, the St. Louis Integrated Health Network, the St. Louis Mental Health Board, the St. Louis Community Health Worker Coalition, Alive and Well Communities, and the Departments of Health in St. Louis City and St. Louis County. And this is powered by the Missouri Foundation for Health. And I think this is an excellent example of how we come together as a community to help get through this crisis. And we're also very glad to see this as well, and this is called the COVID-19 Regional Response Team Initiative. This was established earlier during the crisis, and this team will build on learnings and experience of organizations skilled in crisis response to create a centralized regional system of response to meet the social needs of the bi-state area. As we've said, the COVID-19 crisis isn't merely just a medical crisis, it is also a social needs crisis. And these efforts are meant to complement the work of disaster response. Given all the stress on social service providers from COVID-19, this coordinated regional response team is needed to meet a wide variety of social service needs in our communities. Continuing to meet those needs is a critical element in dealing with this public health crisis. So we commend all those organizations and people who are involved in this, and we will work with the regional response team leaders to see how we can help. And again, finally, this virus doesn't respect zip codes. So as long as one of us in the community is at risk, we are all at risk. And that is one more reason why we are asking folks in the community to stay home, wash your hands, and help us stop the spread. And now I'd be happy to address some questions that we have received from the media.
Dr. Garza, we have received some questions from the media via email already. If members of the media have additional questions, please go ahead and email those to the task force public information contacts, and we will try to raise them either during this live stream or address them as quickly as possible afterward. Dr. Garza, the first question. I'm hoping to get answers to how much it costs to get tested for COVID-19.
So the cost for COVID-19, most of them are borne by, well, if you have private insurance, the private insurance companies are picking up the cost for that. And the majority of them, if not all of them, have waived their co-pays. The federal government is also ensuring that anybody, whether you're insured or not, can receive COVID testing at no cost. And so those plans have been put in place.
The next question, what is the average cost for someone who needs to be hospitalized, and maybe end up being on a ventilator or in the ICU?
Right. So good question. So it's a complex answer though. So hospitalization and the cost for hospitalization depends on a lot of factors. You know, the services that were received, supplies used, all of those different things. Suffice it to say though that intensive care is very expensive. You know, coming up with a precise number would be a little bit challenging, but we can work on some broad windows on what the typical cost is for taking care of a COVID patient and get back to you.
Are insurance companies adding COVID-19 to their coverage plans? Can you address that too?
Yes, they are. The majority, if not all, of the insurance companies have added those to their plans. And as I mentioned previously, I believe all of them as well have waived copays if you're experiencing COVID.
Dr. Garza, we've been tracking some data and see a slight slowing in the increase of cases. Is the task force seeing anything like this?
So, you know, we are monitoring that data over time. We do believe that the things that we've put in place, the social distancing, all of the other things that we've done, are having an impact on the numbers. But I'm always very cautious about those numbers. We don't want to let up on what we're doing now to prevent cases from going up. So we are still seeing, we're still on that steep part of the curve. We still expect to see that surge in cases in the next 2 to 3 weeks. How high that surge goes is entirely dependent upon how much we slow the spread. We rerun the models weekly so that we get a better estimation on where we are in time and space. But I think it's a little bit too soon to be talking about whether there's a decrease in cases, and it's you know, it's very concerning to start talking about how to relax things. We've seen instances in the past, in past pandemics, where social distancing, the other issues have been relaxed, only to have a second wave come on top of it. And so it's this is not the time to be talking about a slowing. This is the time to be really focused on stopping the spread.
Thank you, Dr. Garza. That concludes the questions that have been received prior to the briefing by the task force public information contacts. If members of the media have additional questions, please feel free to direct those to the public information contacts, and we will attempt to address those later today. We'll begin accepting questions tomorrow morning to ask during tomorrow afternoon's live stream. This concludes today's briefing by the St. Louis Metropolitan Pandemic Task Force. Thank you for tuning in.